गुड मॉर्निंग एवरीवन। और हेल्थ एंड एजुकेशन लाइफस्टाइल मैनेजमेंट से मैं खुशी, डाइटिशियन। और आज हम यहाँ पर इकट्ठा हुए हैं एक ओबेसिटी सेशन के एक ओबेसिटी अवेयरनेस सेशन को लेकर, और जिसकी शुरुआत हुई थी 2015 में इसको शुरू किया गया था। और इसको शुरू करने वर्ल्ड ओबेसिटी फेडरेशन द्वारा शुरू किया गया था, ताकि मोटापे से जुड़ी समस्याओं के बारे में जागरूकता बढ़ाई जा सके और इससे निपटने के लिए बेहतर समाधान निकाले जा सके। आज दुनिया भर में बहुत सारे लोग जो है मोटापे की से ग्रस्त हैं, और 2023 तक के डाटा में जो अभी फेडरेशन ने जितना कैलकुलेट करा है, उसकी जो लगभग की संख्या है वो 100 करोड़ है। जो 100 करोड़ लोग हैं वो मोटापे से ग्रस्त हैं, यानी मोटापे से हैं। और इसमें लगभग 650 मिलियन यानी 65 करोड़ ओल्ड एज पर्सन शामिल हैं, और 340 मिलियन यानी 34 करोड़ हमारे एडल्ट्स इसमें इंक्लूड हैं, और 39 मिलियन दैट मीन्स 3.9 करोड़ हमारे जो है बच्चे शामिल हैं। और ये अनुमान लगाया जा रहा है कि 2035 तक इसकी जो संख्या है वो बढ़कर 1.5 अरब यानी 150 करोड़ तक पहुंच सकती है। मोटापा दुनिया भर में तेजी से बढ़ रहा है, खासकर बच्चे और युवाओं में। इसलिए इसे रोकने के लिए स्वास्थ्य आहार, एक्सरसाइज और सही जीवन शैली अपनाने की जरूरत है। और जो 2025 का जो हमारा अवेयरनेस सेशन यानी ओबेसिटी का जो थीम है वो है चेंजिंग सिस्टम, हेल्थियर लिव्स। दैट मीन्स ऐसी चीजों में बदलाव लाना जो मोटापे को बढ़ावा देती हैं, जैसे कि हमारी फूड हैबिट्स होती है, हमारी लाइफस्टाइल होता है। आजकल जो हमारा लाइफस्टाइल है वो बहुत ज्यादा इम्बेलेंस हो गया है ना। और ये डिपेंड नहीं करता कि आपके ज्यादा खाने से ही आप ओबीज होते हो, और ये भी नहीं होता कि आप कम एक्सरसाइज कर रहे हो तो ही आप ओबीज हो सकते हो। ओबीज होने के और भी बहुत सारे कारण होते हैं, जो कि आपको हमारे आने वाले सेशन में, दैट मीन्स जो अभी सेशन हो रहा है उसमें आपको बहुत सारी चीजों से इंट्रोड्यूस करा जाएगा कि इसके किस तरीके से हमारे ये बॉडी पे इफेक्ट करता है, इसको मेजर कैसे किया जाता है, और इसके क्या प्रिविलेंस हो सकते हैं, कौन से फूड हैबिट और कौन से हमारा लाइफस्टाइल मैनेजमेंट को हम किस तरीके से मैनेज करके इससे बच सकते हैं और इसको अपनी लाइफ में एनहांस कर सकते हैं। और ओबेसिटी जो है आज ओबेसिटी डे है, जो कि 4 मार्च एवरी ईयर सेलिब्रेट नहीं कह सकते, हम अवेयरनेस प्रोग्राम चलाया जाता है इसके लिए। सो आज हम भी एक अवेयरनेस प्रोग्राम से आप सबको बताएंगे कि ये किस तरीके से हमारे जीवन पे और हमारे डेली लाइफ पे इफेक्ट डालता है। थैंक यू। नाउ अब मैं आपसे आपको मिलवाना चाहूंगी हमारे डाइटिशियन मैम से, जो आगे की चीजों को आपको, जो कि आगे की सेशन में आपको बताएंगी।
Thank you, Christy. Thank you, ma'am, for introducing me, for explaining awareness giving regarding to obesity.
Welcome, Nino.
Thank you, ma'am. Okay, myself, Neenu Mohan. I'm from Kerala, and my graduation and my uh, degree are completed in Kerala. So today is, we know all, today is World Obesity, International Obesity Awareness Day. So we can give not insight some points about obesity. So next we move on to obesity. Obesity is a chronic complex disease. It's defined by excessive adiposity that can impair health. It is the most case a multifactorial disease due to obesogenic environment, psychosocial factors, and genetic variants. This is the obesity. It's the definition for obesity, and further, it's clarifying by World Health Organization that is the fundamental cause of obesity and overweight is an energy imbalance between calorie consumed and calorie expended, which means we are already take the calorie for our daily activity. So it is an imbalance between our calorie intake and burning the calorie. And extra calorie which will accumulate in our body, extra fat, so it leads to overweight or obesity. Around the worldwide, obesity is considered an epidemic. Over 4 million deaths being recorded in every year. Why? Because it's an obesity patient, they can't they can do something, they can't do something. So it leads to a major cause for death for the so many patients. And causes of obesity. Here, few more causes are obesity. First one is genetic, and also the other one is eating habits. In our daily eating habits, it will depend upon the obesity or underweight. And lack of physical activity is the other reason for causes of obesity. And lack of sleep also. In lack of sleep, our hormonal imbalance occurs. So it also leads to obesity. And also stress is another reason for obesity. And also underlying health issues. Some Cushing syndrome or lifestyle diseases also lead to obesity. And some certain medications, some of them are taking continuous medication, it also leads to obesity. These are the main reasons for the obesity. Next, we move on to next slide, which slide shows the child obesity, how to occur child obesity when we are grow up with normal weight, and children are uh, they're very conscious about they are not conscious about their diet pattern and their physical activity, so it leads to obesity. Why? Because their health activity is low, and their movement is very low, and their on screen is very high. So it gradually increases their body weight also. So it leads to it is a main problem we are seeing in children. And next we move on to the measurement of obesity. Measurement of obesity. So how we can recognize the obese or overweight patient. So here some of the methods that we nowadays we are using. That's the body mass index. Body mass index is by calculated by weight in kilograms. It's divided by height in meters square. So we can calculate anyone is their height and weight depends. So we can conclude that the patient is overweight or underweight. And next is waist hip ratio. It is also method for calculating the obesity. So waist circumference divided by the hip circumference. And also we can calculate the obesity by waist circumference, and also by physical examination we can also measure the obesity. And also we can measure by skin fold thickness also, and also body composition analysis of the one person. It will explain the fat accumulation in our body. So, and air displacement plethysmography is the another method, and dual energy X-ray absorptiometry is the another method. These are the main measurements of obesity. So we can conclude that by calculating this, the person is obese or underweight. Next, we move on to type of obesity based on BMI. BMI already we mentioned, body mass index. There are three classes of obesity based on BMI. That is class 1 obesity, class 2 obesity, class 3. Class 1 means BMI is 30 to 35 kilograms per meter square. It depends upon our height and body weight. And obesity grade 2 is it's BMI greater than 35 to 40 kilograms per meter square. And class 3 is BMI is greater than 40 kg per meter square. They are classified under the obesity grade 3. Grade 3 obesity is also known as morbidity or severe obesity. Next, we move on to the type of obesity which depend upon the fat accumulation. Here, 6 pictures are shown in the slide. So, these are the different fat accumulation points. So, in first point, it is seen in the upper body part of the body. So it is also called as inactivity obesity. Inactivity obesity is the lack of physical activity can cause overweight. It leads to obesity. In this type of obesity, one strong part of the body quickly gains fat and becomes unhealthy. It is the first picture shows that the person is inactive. So in our body, we can the fat is accumulated in these sides of the body. And second picture shows that it's only in adipose in stomach area fat accumulation. It is also called food obesity. Food obesity means overeat and particularly over inclusion of unhealthy food may lead to food obesity. Excessive sugar intake can also cause of food obesity, which may lead to accumulation of fat around the middle part of the body. This is the second picture shows. And next one is anxiety. It is a lower body part obesity. It is anxiety obesity is also called. Anxiety or depression can often lead to overeating and accumulation of fat in the body. Since the body must constantly survive to fight or fight more. In our body is ready for fighting mode, but our fat accumulation due to stress or our any hormonal imbalance, it accumulates below the body. To treat this type of obesity, we must control our anxiety also. Next is the venous obesity. Fourth picture shows the venous obesity. It mainly occurs in pregnancy time. Venous circulation is one obesity cause that genetic in nature. It's also in genetic nature in our family history. We have also carry out the obesity rather than habitual in nature. And this type of obesity is particularly common in pregnancy, and exercise is the best solution for this problem. And next we move on to fifth picture, that is a gluten obesity. Gluten can cause obesity. This type of weight gain is most common in women. Below the our lower part, like our thighs and legs are very obvious with accumulation of fat. It is most commonly in females. It is often spotted during periods of hormonal change like puberty, pregnancy, and menopause. After the puberty stage and pregnancy stage and menopause stage, it shows that lower obesity. And next is sixth picture, which shows atherogenic obesity. People whose fat tend to accumulate in stomach area. Most of them are suffering from stomach. Their stomach is large. So this is the atherogenic obesity. This is particularly dangerous condition. This can affect the other organs and leading to breathing problems. These are the type of obesity which shows in this slide. Next, we move on to the complications. The complications of obesity. What are they? Here we already mentioned different type of obesity and which part of the obesity occurs. And next, we move on to complications of obesity. What are the main complications when we are obese? So here are so many features shows in brain neurological disorders like when we are obese, our hormonal get variations. So diabetic, intracranial hypertension. We are it's most probably of hypertensive and cardiovascular disease like hypertension, dyslipidemia, and coagulopathy in cardiac related chronic inflammation, endocardial dysfunction. and also in pulmonary disease, and like intolerance of obstructive sleep apnea, asthma, like diseases, and gastrointestinal diseases like gallstones and liver disease and gastric esophagus, non-alcoholic liver diseases, and type 2 diabetes and the PCOD, and when we are obese, we can also faces the arthritis problem. And type 2 diabetes is excess fat in the body which resistant like insulin. And in heart diseases, we rises blood sugar, blood pressure, and also cholesterol. It leads to narrow the hardened arteries, and it blocks the blood flow and increases the risk of heart and the stroke also. And sleep apnea, and it's a excess fat makes airways small. So this causes breathing to stop or short periods of during sleep. Low blood oxygen can cause an irregular heartbeat also. And the kidney disease also, obesity can and type 2 diabetes besides high blood pressure directly impact on kidney. And in liver, the fat buildup around the liver cell lead to damage to liver also. And gallbladder, it also increases the possibility of gallstone due to high cholesterol level. Osteoarthritis is the excess weight gain due to obesity. It puts pressures in the joints and knees and hip and ankles, cause pain and swelling and stiffness in the knees. And also make cancers, and accumulation of visceral fat around vital organs increases the developing cancer also. And another one is infertility. Different type of obesity can lead to hormonal imbalance, which also lead to PCOD and PCOS and infertility also. These are the main complications are the obesity. Next, we move on to the treatment for the obesity. So here the diagram shows that we are already mentioned that our obesity is categorized based on our BMI rate. So here around 2 to 5% of weight loss. It is our goal to reduce the weight. So we can use some different treatment. So in first, we are in BMI like greater than 22.9. So we can intervention in our behavior changes. So like yoga, exercise, and our diet is also included in 2 to 5% of goal of weight loss. And in 5 to 10% of goal of weight loss, like BMI is greater than 25, we can opt for nutritional intervention like meal replacement and dieting, fasting, and these are the included in 5 to 10% goal of weight loss. And about 25, 27 BMI greater than 27 with comorbidities like any comorbidities like diabetes and hypertension and cardiac disease. So we can move by pharmacotherapy, some medication that will help for losing the weight and also balancing our comorbidity like diabetes or hypertension. In this case, around 5 to 20% of weight loss is needed. And above BMI is greater than 30, we can move with a surgical procedure, like not very large one, like endoscopic procedure. Around 10 to 20% goal of weight loss, we can move to endoscopic procedures, like extra fat is removed from the body. And about 40 or about 35, we can move with a surgery, like bariatric surgery. So if the patient is greater than 35 BMI, so they want with comorbidity, they should follow with surgery. It's a better option for increasing their life. These are the treatment for the obesity. Next, we move on to the healthy eating pattern for the obese patient, and also it's also helpful in the prevention of obesity. Also, obesity, if the person is in grade 1 obesity, so this type of healthy eating pattern also reduce the increase their BMI level also. Here the diagram shows that in lower part, we must include lot of fruits and vegetables in higher amount and reduce the quantity of grains uh, and in upper portion, we unhealthy fat also included in the diet. So which shows that is high intake of fiber and the foods also. And next we move on to prevention of obesity or overweight. And prevention, how to prevent our obesity. By we must know about the around the childhood. We should know how to prevention and gradually work to change our family eating habits and activity level rather than focusing on children's weight. So we should concern about most of the parents are concerned about the baby is underweight, so he was not taking something. So we should change our family eating pattern. Most of them are taking outside food. At the new stage is the baby also taking outside food. So try to avoid the extra habit from outside eating and ensure appropriate weight gain during pregnancy. And the pregnancy time, we should concern about weight gain. Inappropriate weight gain also lead to obesity in mother also in baby also. Follow breastfeeding guidelines. We already know to do hourly breastfeeding for the baby and not including around 6 months. We should not include the extra food item for the baby and encourage physical activity. Children should have 60 minutes of moderate physical activity most days of week. More than 60 minutes of activity may promote weight loss and provide weight maintenance and reduce the screen time in front of the phone, computer, and TV less than 1 or 2 hours daily. Most of the children are nowadays they are time spending by on screen. So it also the main cause of inactivity. It also leads to obesity and encourage children and teens to eat only when hungry and to eat slowly. And in eating slowly, the enzymes are, our hormones are working. Otherwise, it's not working. So it is a more chance of being obese. And don't use food as a reward or withhold food as a punishment. Some of them are telling you are doing this and give the some chocolate or something like so. Try to avoid food as a reward and keep the refrigerated stock in refrigerated. We can include with the fat-free or low-fat milk and fresh fruit and vegetable instead of soft drinks and snacks high in sugar and fat. So we can substitute with the sweet and chocolate with fruits and vegetables and also serve at least 5 servings of fruits and vegetables in daily and also encourage the children and teens to drink water rather than beverages with adding sugar and soft drinks and eat meals together as a family. Family meals can create healthier eating habits also. And also, we can choose whole grains in daily in our daily diet, and also in the adult person, they can measure the food that's in correct portion size also, and also uh, we can uh, we can include energy density food, not the amount. It's only depend upon what is the energy of the food. And next we move, these are the prevention methods for obesity, preventing the obesity. And thank you.
वेरी ट्रूली सैड नीनू, बहुत सारी चीजें आपने आज बताई। तो जैसा कि अभी हमने पहले भी डिस्कस किया था कि ओबेसिटी सिर्फ एक कारण ये नहीं है कि आप मोटे हो क्योंकि आप एक्सरसाइज नहीं करते हो, क्योंकि आप खाना अच्छा नहीं खाते हो, लेकिन ओबेसिटी बहुत सारे कारणों से होती है। और इसको बचाव करने के लिए हमने कुछ पॉइंट्स बताए हैं। जो सबसे पहला पॉइंट है स्ट्रेस को कम करना, और अच्छे से नींद पूरी लेना, जो भी फास्ट फूड से उन्हें ना खाना, और फिजिकल एक्सरसाइज जरूर करना, जो भी आपसे बन पड़े। जरूरी नहीं है कि आप जो बाहर जाके जिम में ही करें, आप घर में भी कर सकते हैं, आप योगा भी कर सकते हैं, आप रनिंग भी कर सकते हैं सड़क पे जाकर के। अगर आपके आसपास पार्क है तो आजकल पार्क में भी छोटी छोटी से एक्सरसाइज की साइकिल और कुछ कुछ चीजें लगी होती हैं, आप उन्हें यूज कर सकते हैं। टीवी कम देखें। कई बार क्या होता है, जब हम टीवी देखने बैठते हैं तो हमें पता ही नहीं चलता है, हम सिर्फ देखते चले जाते हैं टीवी। और 1 घंटा 2 घंटा तीसरा सीरियल चौथा सीरियल करते करते पता नहीं कितने घंटे वहीं बैठे बैठे निकाल देते हैं। तो ये कोशिश भी हमें करनी है जिससे कि हमारी हेल्थ ठीक रहे, और खाने में बैलेंस डाइट के साथ साथ सब्जियों और फलों का बहुत सा प्रावधान रखेंगे, तो बैड हैबिट से दूर हटेंगे, और बहुत सारा पानी पीते हुए अपने जो स्वास्थ्य की ओर ध्यान देंगे, और ओबेसिटी से बचाव की ओर हम सब मिलकर के एक पहल को करना चाहेंगे। तो बहुत बहुत धन्यवाद आप सभी लोगों का। और अगर कोई क्वेश्चन है आप लोगों के ओबेसिटी से रिलेटेड तो आप लोग पूछ सकते हैं। रहनुमा जी, आंटी, खुशी, एनीवन वांट टू आस्क? कोई भी कोई सवाल पूछना चाहता है तो पूछ सकता है। कोई सवाल है आपका?
नहीं मैम, मेरा तो कोई नहीं है।
ठीक है, चलिए, तो बहुत बहुत धन्यवाद। ओके रहनुमा, अभी बैठ जाओ कहीं पर। खुशी, नीनू,
हाँ जी मैम।
तुम दोनों लोग जरा उसके ऊपर क्या कहते हैं, जो हमारा दूसरा पर क्या है सेशन, वुमेन्स डे के ऊपर जरा रेडी कर लो। तब तक मैं और रहनुमा थोड़ा सा हम लोग कर ले रहे हैं, ठीक है?
नो।
वुमेन्स डे, वुमेन्स डे,
हाँ हाँ ओके मैम।
वुमेन्स डे को एक बार देख लो। तब तक मैं और रहनुमा एक बार थोड़ा सा क्वेश्चन आंसर सेशन कुछ थोड़ी सी चीजें कर लेते हैं। रहनुमा, इसको फोन को ना ऐसे रख दो, थोड़ा घुमाओ कमरा को, ऐसे घुमाओ इधर की तरफ ना, कपड़े टंगे हुए आ रहे हैं वो अच्छे लग रहे हैं। हाँ बस अभी ठीक हूँ, अभी परफेक्ट आ रही है। लाइट के अपोजिट आओ। हाँ ऐसे आओ, लाइट के अपोजिट आओ ना तुम दिखोगी। यस, दिस इज परफेक्ट, ये सही आ रही है ना? और अभी कहाँ हो, कमरे में हो जहाँ भी
यस
हो?
मैम।
थोड़ा सा कमरे का दरवाजा और बंद करो।
मैम दरवाजा नहीं है अभी रूम में।
अच्छा अच्छा ठीक है, आवाज कोई ये बोल देना कम से कम 5 10 मिनट 15 मिनट के लिए ना, पता चला पीछे से आवाज आ रही हो थोड़ी सी, थोड़ी देर के लिए बोल दो कि 10 15 मिनट के लिए, अभी थोड़ी देर के लिए तुमको नहीं बुलाएंगे, है ना? बाकी लोग अपने आपको म्यूट कर लो। हाँ कर दिया मैंने कर दिया। और कैसा चल रहा है, तुमने क्या खाया? अभी देखो तुम्हारे खाने की सारी, रिफत क्यों नहीं आ रही है? रिफत
रिफत
तो बोलूं क्या, एक बार कॉल करके बोलूं?
मैम पता नहीं, रिफत को तो आई नहीं रही है, ग्रुप पे भी नहीं दिख रही है वो तो।
हाँ वो भी है, उसका भी ऐसे ही चल रहा है। 1 मिनट में इसको कॉल कर लूं बस, एक सेकंड रुक जा, अगर उसे ज्वाइन करना होगा ना।
ओके मैम।
बस उसके बाद हम शुरू कर लेते हैं। थोड़ा सा हम बात करेंगे रमजान के ऊपर, फिर आप थोड़ी सी बात करेंगे कि क्या कहते हैं, लाइक हमें खाने पर क्यों जोर देना चाहिए, खाने पर क्यों ध्यान देना चाहिए, और अपने बारे में भी थोड़ा सा बता देना कि लाइक ऐसे ऐसे हम कर रहे थे, और थोड़ा सा वजन भी कम हुआ है, और साथ में मतलब क्या कहते हैं हेल्थी हैबिट डेवलप हो गई, जो चीजें हुई हैं, है ना? स्ट्रेस खत्म हुआ है, कॉन्स्टिपेशन नहीं है ना, गैस वगैरह कम बन रही है ना? आपसे अभी कर लो, बात कर लो, 2 मिनट कर लो अभी, जब तक मैं इधर बात कर रही हूँ। अभी उन लोगों से बात कर लो, उनको बोलोगे अभी तो, जो कुछ पूछना है जल्दी पूछ लो मुझसे, फिर अब 10 मिनट में बात
मैम
करेंगे।
रोटियां बनानी है।
रोटियां भी बनानी है अभी? अभी अच्छा, बच्चों के लिए, बच्चों
जी
के लिए।
मैम।
हाँ बस 10 मिनट लूंगी, है ना? चलो नहीं उठा रही है, हम करते हैं। इनको तब तक कुछ और खाने पीने के लिए बोल दो। दे दो, बता दो कहाँ रखा है, नहीं तो फिर ये लोग
मैम
तो
बच्चे बच्चे तो स्कूल गए हैं, देवरानी आई थी बाजी रोटी बना ले, मैं आ रही हूँ उसमें।
अच्छा अच्छा, ओके ओके, चलो ठीक है।